Okay. Hi, good evening, everybody. Welcome back to another session of our webinar on a Wednesday evening. I'm Dr. Betty Tay, the CEO of Beating Hearts, and Beating Hearts is committed to actually bring you, education online to your home. So I'm very happy today because Dr. Kathiravan approached me, and since then we have been talking about this webinar, and now we have our first dental and maxillofacial webinar. And I think following this, we will have some more dental webinars. We are arranging for more. So without further ado, maybe you can introduce yourself a little bit, and then we can go ahead with the talk.
Okay, thank you, Dr. Betty. Yeah, I wish to record my appreciation for giving me a space to speak in your wonderful series of webinar, which I appreciate very much also, because it gives an insight to other fields of medical practice. Although I'm based from dentistry, but still we have to treat the patient as a whole, not as a whole. So we have to see holistically and understand what other things are happening in the other parts of their body. Just briefly about me, let me just start on my slide. Let's see, more share. Okay, right. Is my slide visible?
Yes.
Yeah, okay. I'll start about myself. My name is Kathiravan. I graduated in 1993 from University Malaya, from Faculty of Dentistry. So I had an interest in surgery. So I further specialized in oral and maxillofacial surgery from USM up north. That's where I got my training in the maxillofacial region. But I also have postgraduate qualification in orthodontics, which actually go hand in hand in a specific part of maxillofacial surgery, which I have particular interest, which I will share more about soon. So I'm working in two to three hospitals. Mainly my residence, my place of residence, or I'm considered a resident in Columbia Asia Hospital in Stapak branch, but I also visit Tung Shin Hospital and Avicenna Hospital, Shah Alam, where I have a team of assistants and surgeons, and even we have our own dental laboratory, which is capable of doing 3D printing, even custom-made 3D printing of metal prosthesis like the jaw, or even some part of the missing part of the body, which I will show later on. Okay, diving into our topic, oral health and maxillofacial health. WHO, which is the World Health Organization, have categorically said if a person does not have a good oral health, is not considered healthy. This shows oral health, oral disease encompasses a range of disease, which includes even something very considered very small and even ignored, like dental caries or periodontal disease, tooth loss, among other things. So if there are oral cavity, which is like a window to your total health, many things we can judge or anticipate something wrong with the metabolic system just by looking at the oral health. So if your oral health is not healthy, you are not considered fit and healthy. Okay, right. So everybody says always going to the dentist is expensive. Every time they go to a dentist, they lose a lot of money. But the truth is, dentistry is not expensive. What is expensive is neglect. It becomes expensive when you don't go to do your routine checkups or routine, examination and routine treatment, so that we can detect whatever things that that is not supposed to be happening sooner. So when we detect sooner, prevention is always better than cure. So when things get worse, that's when there will be more pain, more discomfort, and more loss of monetary values. Okay, come to the first topic, halitosis, bad breath. A lot of Malaysians suffer from this, but it's a area that people don't talk about. why it is too personal or intimate. I'm sure you have come across some friends who have this problem. Yeah, how do you, approach this subject? That is another topic altogether. But what I want to stress in this is a lot of things in the oral cavity can cause this type of bad breath from the food you eat, from, when we take food, we wash our utensils, we make it clean and eat. But then how many times do you clean your mouth? Maybe probably once a day only, but you use it more than once a day for eating, I mean. So isn't it, fruitful? You wash your mouth more than a day. So that is something to think about. But at least 6 months once or 3 months once, you have to have some routine check to make sure your oral condition is healthy, so that people don't avoid you for things that sometimes you don't realize. Yeah. There is a lot about, I'm told there are about 700 species of bacteria, not bacteria, types of bacteria. So this bacteria, produces a lot of biofilm. It coats your tongue. So, you brush your teeth, you brush your gums, but how many times did you clean your tongue? A lot of microorganisms are resting, playing, happily enjoying the oral environment on your tongue. So that is one of the cause of the bad breath. Okay, this is gingivitis. What progresses as gingivitis, like in this case, in the lower right, you see this is the initial stage of gingivitis where there is inflammation of gum. At this stage, sometimes when you brush your teeth, there will be some bleeding, but it goes away, it gets better. But this is just the initial stage. When it progresses, then you will get gingivitis all over the teeth. Yeah, this is still reversible. You do take the proper treatment, treatment is done, this gingivitis can cure and you can become normal, healthy gums. But if it progresses like this on the right side, this is where problem gets worse, where a lot of plaque and calculus gets retentive. And what happens is irreversible bone loss. So once irreversible bone loss happens, this is where you will feel your teeth is getting longer or even loose or even sensitivity. These are some of the symptoms that can make life difficult for you. Okay. Okay. Coming to association of, periodontal disease, that's why those days I'm not sure whether they are still encouraging now pregnant mothers to have a dental checkup to make sure the bacteria in their oral cavity does not affect the baby, because there is a research that has been studied and proven that patients, mothers who have poor oral condition have preterm birth and low birth rate. So just only folate might not be enough. A proper dental routine cleansing and checkup for mothers is vital. Okay, and infective endocarditis. Maybe Dr. Betty can weigh in on this also. A lot of bacteria can affect the heart if the heart is compromised, especially if it has a vulnerable surface like a damaged endocardium or even artificial valve and things like that. Okay, patients who are undergoing heart surgery, bypass surgery, are often encouraged to visit the dentist to make sure the oral hygiene is at optimum level, so that whatever bacteria does not, cause a bacteremia stage to affect the heart later on. So this even highlights how the oral cavity is connected to the whole body, and what you think is something minor may cause bigger problems later on. Okay, so gum swelling or infection can be also induced by the medication the patient is taking. Like in this case, it is a nifedipine-induced gingival hyperplasia. Okay, it's been given for a patient who having high blood pressure. So medications can cause some effect on the gum. So we have to work together with the physician or the doctor who prescribed this medication to ask for any alternative medicine to control this type of problem. This one is
nifedipine, right? Is it?
Yeah.
Is it the calcium channel blocker?
Yeah, that's right. Calcium channel blocker.
Any calcium channel blocker can cause this.
Yeah, can cause this. That's right. So yeah, but not this happens is because it's compounded by other factor, which is patient's poor oral hygiene and a restoration, which is plaque accumulating. If they have proper oral hygiene, they take care of their health. Even if you're giving nifedipine, it won't be so bad. It still be controllable. But treatment for this will be maybe even to remove some of the gums which is overgrown. Okay, patients who are having this acute monocytic leukemia also can have problems in the gums. Not only the disease process, even the medication, the chemotherapy they are having can cause problems in their gums. So they need to be co-managed with the dentist or oral maxillofacial surgeon. Okay, what other conditions that I've seen? These are not not a very exhaustive list of oral maxillofacial condition that can happen. It's just only what I've usually see in my practice. Like in this on the right, if you see there's the extraction socket which has not healed. This has not healed because patient has a medical condition. This is osteomyelitis, where there is a bone infection regarding and this patient will have pain, a lot of food gets stuck, and infection. Sometimes the medication, the drugs that the patient is taking, like Fosfomax, which is osteoclastic, anti-osteoclastic activities by Fosfomax type of medication can cause this type of osteonecrosis. Yeah,
Okay.
these white patches, a lot of
It's
things
caused by Fosfomax.
Fosfomax, yeah. This
Okay.
medication, it's a medication given for osteoporotic ladies, I suppose.
Yes, that's right.
Yeah. So they are commonly prescribing this type of medication without thinking of their consequence in the oral cavity, because it doesn't allow proper wound healing. So these are the things. This type of tongue, thick coating tongue, or this type of white flakes is a candida infection. This type of candida infection is not really common, but can happen patients who are having poorly controlled diabetic or poor dental hygiene. They are wearing dentures, but they don't clean it well. So they can have this type of infection. But these are all easily treatable, and they can get back to normal. Yeah. This condition, patient is having a swelling. This is just the initial stage, but this can get worse. Can get worse very fast. What's happened is infection in the oral cavity, maybe just a dental caries or infection from their wisdom teeth, is spreading in the submandibular and submental region. Okay, when this happens, we are afraid of the airway compromise, So this has to be treated aggressively, where this abscess needs to be incised and drained. And yeah, this maybe people will think wisdom teeth, is something that is not serious, but it can cause a serious condition called angina, this type of wisdom teeth. This
Angina as in the
sorry,
cardiac
yeah.
pain?
No, it's called a Ludwig's angina.
Okay.
Ludwig's angina. Sorry. Yeah, I should say the full term, Ludwig's angina, because airway compromise. I forgot I'm talking to a cardiologist.
Okay, what? Angina.
Okay.
Sorry, how to spell it?
It's called Ludwig, Ludwig.
Oh,
Ludwig,
like
Ludwig's
Beethoven,
angina.
like Beethoven.
Yeah,
Okay.
right. So yeah, this wisdom teeth usually can be removed by a general dentist, but in some cases like this, where the nerve is very close to the wisdom teeth, like this is the inferior alveolar nerve. You see, the black bundle is the inferior alveolar nerve. When this close, the general dentist usually will refer to the oral maxillofacial surgeon to remove it, so that there is no compromise in the inferior alveolar nerve. If there is a compromise in the inferior alveolar nerve, patient will feel numbness or tingling sensation in the lower lip, chin, and if it affects the lingual nerve, even in the tongue, might be permanently compromised. So even wisdom tooth is not removal surgery. It should not be taken lightly. Okay, this is infection due to the wisdom tooth. See, is red, angry, patient is in pain. But what is worrying us is the airway compromise. There has been reported of cases where patient couldn't breathe, and even emergency tracheostomy needs to be done under LA, so that the patient can breathe just because of this type of dental infections. So this is how it is trained. Okay, it looks very gory, but This is how aggressive that it is treated, with drains at 3 places. If there is any ENT colleagues, they might, they might understand also this type of drainage and how it should be prevented. So this is a video on the amount of pus that comes out. So this is how it will drain. And this is something that is good. Sometimes it is just a cellulitis. It's just bloated, but it has no discharge. So even then we have to still drain. So by cutting and relieving the pressure, it allows the decompression to take place.
Yes.
Okay. So this is a complication of extraction, where after extraction, what has happened is there is an oral enteral fistula. There's a hole here where water, whatever food, when the patient eats, leaks through the nose, because there is a communication between the root of this posterior teeth to the antrum. So when you remove the posterior teeth, if it doesn't heal properly, there is oral enteral fistula. This needs to be covered or closed or stitched like this. Okay, this is it's a very small child, had a persistent swelling in the lower submandibular region. So we removed it to send for biopsy, but something peculiar came out. Even this is the biopsy report. If you see, it says caseating granulomatous inflammation, highly suggestive of tuberculosis. We thought, lo and behold, tuberculosis is something part of the history. But see, it is coming back, So the child was sent for appropriate treatment by to the medical colleagues.
Wow.
Was diagnosed. Yeah.
So
This is,
interesting. He had
yeah.
TB before?
But then no pity, no history, nothing suggestive of. We were thinking it was just an infection and just giving antibiotic, but it never subsides. So we had to take out the loan and send for biopsy. So yeah. This another lump is this is called mucocele, a small swelling in the lip. It sometimes goes away, but it comes back, goes away, comes back. What's actually happening is there is a minor salivary gland in the lips, which has got injured. And this ballooning bluish thing is because of the saliva that is leaking there. So every time it gets swollen, you accidentally bite it and the saliva leaks out, but it comes back because the damaged minor salivary gland is still in the lower lip. So treatment for that is to remove that minor salivary gland and stitch, then it won't come back again. So this is after everything, removing. This is just a glomerulus, this papillary growth of the gingiva, which when in size, it does not cause any problem. Yeah.
What's the reason for that? Sorry.
This one. This one can be because of the hormonal changes. Pregnant ladies will have some growth of the gingiva. So this type of growth. So we just remove it.
Without treatment, will it go away?
No, it won't go away. Yeah, it won't, because already this big already. Okay. Yeah, it won't go away. It needs to be incised. Yeah. But these can be done with a laser. I think this was done with a laser, and you get very little bleeding. Okay, this one earlier I said after periodontal treatment, you get the teeth longer and you have sensitivity. Okay, this is the treatment for that, where you can reposition the gum to close. But still, if there is already extensive bone loss, the amount of recession will be still there. Not as bad as before, but there is some recession, and we can have some sort of localized treatment for the sensitive teeth. So yeah. Yeah, this is called ranula. It's swelling below the tongue. Okay, ranula is a frog. Remember ranula, a frog with a big belly. Okay,
yeah.
it's named after that. What's actually happened is salivary gland, the submandibular salivary gland or the sublingual salivary gland is damaged or blocked because of calculus or any other things that causes the saliva to pool around it. So if we just cut and incise and just let the saliva to go out, it will still come back because of the cause is still there. So the treatment for this is to remove the whole affected gland. So it can be done intraorally if it's this small, but sometimes it is bigger like this. It is submandibular. So this patient had multiple stones or calculus in the submandibular gland. So we have to cut extraorally to remove the submandibular gland. You might think, removing submandibular gland will have patient suffer from xerostomia or reduced saliva. Actually, in the mouth, there is so many glands that secrete a lot of saliva. So patient would not feel he has lost significant amount of saliva production. There's no problem. This is a bread and butter of maxillofacial surgeon. We always deal with trauma, and this type of pan facial trauma, we reduce the facial fractures and with bones and plates is common practice, especially those maxillofacial surgeons that are working in the government sector. There is not that many maxillofacial surgeons in the private sector. More of them are in the government side, dealing with this type of trauma. Okay, but this patient, I saw this patient, what is interesting is this patient had a trauma on the orbit, and we had to reconstruct the orbit. What gave me palpitation and never forget this patient was he was a pilot. So if I screw up his eyesight or he's seeing double or he's seeing blur, then I'll be in deep trouble. Luckily, none of that happens. But we are frequently called to manage this type of patients, and we do incision transconjunctival. That means the incision are usually inside the eyelid, so it's hardly seen. This is the patient. So initially how it is, and then he recovered. Thank God. This is the video to show,
Thank
to
you,
check the
not
eye
thank
movement.
you.
Yeah.
Thank you, not thank God.
No, thank God. I was praying after that. This is to see there is no restrictions in the movement of the eyes. Yeah. Okay. We are thankful to see this type of cases because it's predictable and we know we can give them a good result. Like this type of trauma or lips laceration, there will be usually no scars. Babies, sometimes, in the blue moon, I'll be called to, newborn babies. This is not a newborn, he got teeth already, but this is called tongue tie, to release the tongue tie so that it does not affect the speech or the ability for the tongue to move.
I
Okay,
had
so
this done, I had this done when I
you
was,
had done. Oh, when you were a child. Okay.
yes, 5 years old.
Yeah. 5 years old. Oh gosh. The
Then it's eaten
maxillofacial
my
surgeon.
tongue.
I'm calculating how old the maxillofacial surgeon will be or the dentist will be.
I think it's
No,
just a
what be
GP.
ENT?
It's just a
Who?
GP.
Oh, GP. Okay. All right. Now I think they prefer in the hospital.
Yeah.
They won't allow a GP to touch a baby. Okay. Sometimes the baby is born with a teeth like this. The problem with the teeth, actually, there is no problem, but the problem is to the mother, or the teeth might be mobile and we are afraid the baby will aspirate it. So in that case, we remove the teeth, or if it's hurting the mother from, giving breast milk, then we have to remove it. Usually these are called neonatal teeth, and this is not the person's permanent teeth. He will get another set of teeth, so no problem. Okay, these are also child, and they are it's not so common nowadays, but does happen. I mean, all the patient's teeth is spoiled. What happened? If you ask the mother, they say when they come out also they spoil, but not really. So this is called a rampant caries or bottle nursing syndrome. That means they let the baby to sleep with the bottle in the mouth. So when that happens, the bottle will have all the sweetened things. All the teeth get caries like this, and there will be infection and swelling. So these are some of the things that we need to educate the mother to not to do. They have to, even though it is deciduous teeth, they still have to clean them so that the patient does not have problems like infection, pain, and this type of teeth can even affect the permanent teeth later on. This is my pet project, cleft lip and palate. So I enjoy doing cleft lip and palate. Mostly, I'm sure you'll be thinking plastic surgeons, but we also have training and doing this type of treatment. This bilateral cleft lip and palate. Most of the time, I don't even charge them. So because this is what I love to do, palate repair. Okay, coming back to this one. So we are going to more serious. This type of swelling and infection, we have to, in this case, it was a multidisciplinary approach where plastic surgeon, orthopedic surgeons, even ENT surgeons were involved. He had amyloblastic carcinoma. Okay, that caused this type of swelling. See how the lesion has eaten up the bone. So we had to resect the bone and reconstruct it with fibula. Fibula graft like this is a fibula, patient's leg bone taken from the leg, and then the skin graft was done because the skin was taken from the thigh. That's why you see a lot of hair here. So yeah, this type of then yeah, you can get a pretty decent result. These are false teeth after has been rehabilitated with denture. We published this case, actually published.
Oh, very nice.
yeah, this was a case of carcinoma. So we had to remove, and it was locally reconstructed. This is another case where the lesion has actually eaten the bone here. This is how it presented. Nowadays, the CT scan can give you so nice definition of the bone. It's just a normal CT scan, and so you can see the definition of the bone, the swelling, the nerves, and things like that. But this is the biopsy report, and the report has said squamous cell carcinoma, moderately differentiated. So one of the most difficult thing is to break the news to the patient. I think our dental or medical school, they don't really teach us that, but it needs a lot of tact. Many of them are still in disbelief, like something like a swelling like that can be so life-changing. I mean, the treatment is very difficult. Oh, coming back to bread and butter, this is what actually pays the bill. Dental implants. So dental implants are just piling in the bones that we do. So that this is the perfect, this is what currently the most ideal way to replace missing teeth. Okay, it will feel like your own teeth. We pile some titanium screws inside the bone and then fix. This is a procedure of how it's done, but this is the how it is done. So you'll have teeth, and it does not disturb your surrounding teeth like a crown or brushwork, which they have to file down your natural teeth. This one does not. You don't have to file down your natural teeth. Okay, why the horse is here in the middle of a presentation? Any idea? Not to say for me to go faster, but to tell me there are people who have condition of when they smile, they show a lot of gums like the horse, right? We have treatment for that also. But that treatment is depends on what is the exact cause of the cause. Maybe it's because of the hyperactivity of the upper lips, or maybe because of the maxilla, which is, increase the vertical dimension. So we have all the teeth, which is very smaller. So we can reposition the lips. Now, all the treatment, all the surgery is done intraorally, so they don't see it. We can reposition the lip lower down so that when they smile, they don't see the gum so much. In this case, that was what was done, and some gingivectomy, so the teeth is a little longer. So
I
yeah,
have that,
so
I think. I laugh, I think.
I would love to see you again. Yeah. Okay. Okay. Yeah. This is another pet project of mine, which I love to do, correcting facial deformity. Yeah. This patient, if you see his facial profile, I see the lower jaw, the mandible looks longer. It is not symmetrical. It is not proportion. So he needs a combination of braces and also orthodontic surgery. So that's what we do. His how his intraoral is, all crowded, cannot bite properly. Sometimes they are even problem with the TMJ, temporomandibular joint. So that is corrected. This is after treatment. This is after
My
treatment.
God,
So
so
he'll become,
handsome now.
yeah, he will become a handsome man. Yeah. So this is like really a life-changing procedure, which I enjoy doing. So I work with Dr. Firdaus. I think Dr. Firdaus has talked to Dr. Betty. Maybe he will be coming the next. So this is what both of us enjoy
Yes.
doing.
Oh,
And
I see.
yeah,
Firdaus is coming. I don't
yeah,
know when, maybe in June or May.
sure.
I'm not sure.
Right.
I will look it up.
Okay.
It's
Yeah.
very
So
interesting.
nowadays we do all the planning in the computers. These are the surgical guides. These are the actual surgical procedure. So this is another patient who had a similar problem. See, the face is concave. It is like that. This is the end
Oh,
result. Yeah.
so
So
this
they
is done
become
by you and not the plastics.
Yeah, no, it's done by us. Plastic, yeah, that's why people get confused. Plastic usually deal with the soft tissue. We, the oral surgeon, deal with the bone. So the base is the bone. The bone needs to be in the correct place for them to, enhance. The soft tissue part is usually done by the plastics. Okay,
Oh,
so
but oh,
yeah,
the result is so natural and so
yeah,
beautiful.
yes, so beautiful. That's right.
Yeah, she
So
must be so
yeah,
happy.
yeah, this guy before and after, yeah. This case, another case where this surgery is actually done by the plastic surgeon. They remove the nose. See the nose? They removed because of some CA. The patient has a wedding to attend. Can he go without the nose like this? So this is where the maxillofacial comes. We don't only do the bone surgery, we can help to do a prosthesis. This is a prosthesis of the nose. See,
Oh,
at least he can attend some functions like this, and it is attached to these spectacles. This one we can also put some implants and fix it to the implants. Okay, so but this at an advantage, you can take it out and clean it and put it back. So we can do that. This one, eyes also, missing eyes or ears, can be done. Okay, this infection from the teeth that has gone to the antrum. So in this CT scan, you can see how extensive it is. It has eaten up the antrum and given ENT problem. But the cause is not because of the ENT, it's because of the dental. So the dental part needs to go in, need to clean all the infection and graft it and close the lesion. So this is how after the closure. Yes, sometimes teeth also can be naughty. They don't grow in the correct place. So they grow up in the gums here and cause cystic lesion. So we have to remove the teeth. Or if the teeth is salvageable and patient requires the teeth, we can actually plant it in that correct position. Okay, like this case, the canine is grown here. It is not growing in the correct place. So we expose the canine and use orthodontic braces to bring it to the correct position. Okay, so this is how it is. So the canine is in the palate here. So if you just leave it, it will never come out because the direction of growth also is not correct. So we track it, use the orthodontic braces and wires, do what only dentists can do, and then bring it to the correct position.
So it won't move.
It won't move by itself. It is some force to bring it down.
And you can place where
yeah, but that's supposed to be like this. This one was higher up, now is the correct position. This is the final result.
Wow.
Yeah, this is the teeth here at the end of it here. From here, on the left side. Yeah, from the nose, near the nose here, the teeth is here. But then here, the same patient is come down here. So yeah, this is a cystic lesion in the lower mandible. Okay, so cystic lesion, yeah, this is straightforward. Okay, this is an interesting case which I'd like to share. This patient had teeth that was growing everywhere. This is actually his decidus teeth here. So you have heard of transplant of the kidney, transplant of even the heart, but this is the transplant of the teeth. We actually took out the teeth from here and immediately position it at the correct place. This is how it is at the end of the treatment.
Please explain again, sorry, because this is my first time seeing dentistry.
Okay.
Yeah,
this is
teeth first time. The first, where's the teeth?
This is autologous transplant of teeth. That means teeth, the patient's own teeth taken from a different location and then transplanted in a different location.
Okay, where is the teeth in the first place before
First place. Okay, on the right side, you see like a CT scan. This is called a CBCT.
Okay.
Can you see an arrow? My arrow here? This is where the teeth is. One.
No, I can't see the arrow.
Oh, you can't see the arrow. I'm pointing here. Can see the arrow here? Okay, CT scan near the nose here.
Okay. I can see your arrow.
I can see the arrow near the nose here. There is the teeth. There's actually one of the teeth here. This teeth is actually the incisor.
Okay.
This is the incisor. This is the canine. This is the canine, and this is the lateral incisor. So this incisor needs to be placed here. Lateral needs to be placed here. Canine needs to be placed here. That was what was done here in this lower right. This canine. This is the teeth that was here. So this teeth was taken out and placed here, and placed here. Now he will just need a minor braces to correct the alignment, something like that.
How old are these people?
How old? This guy was about 20. He's been living so long without teeth in the anterior. Yeah.
And he thought that it's like he was born with no teeth.
Yeah, without any teeth. That's right.
But it's actually grown somewhere else.
Somewhere else. That's right.
Oh.
So, yeah, you can transplant. Yeah. Okay, this was a cyst in the lower anterior. See, when you remove the cyst, the teeth is like hanging. There's nothing there holding to the teeth. So we have to send this to histopathological, and this came out as aneurysm bone cyst associated with ossifying fibroma. So such a long term, but luckily it's a benign condition, and we grafted this area with some bone and closed, and it's okay. So sometimes they are lucky. And this patient also came with white lesion. Of course, they are cancer phobic. They are worried, why my mouth, I'm still young, it's whitish, this doesn't go, and it's burning. But this is bilateral and it was extensive everywhere. So we are also worried. Conclusively, we need to take some biopsy and send for HPE report. But we also want to see the patient's medical condition, if it's immunocompromised or is he promiscuous whatever that it means, yeah, and things like that, the blood investigation and things like that. But after the biopsy, it turned out with as lichen planus with benign hyperplastic reactive changes on the epidermis. So, but still we have to monitor this because our lichen planus is something like an autoimmune disease where we can control the symptoms, but it will never disappear. Okay, this type of patients will have some condition like this, which is they can't tolerate very spicy food, and this type of
This also
thing,
can happen in the mouth, yeah?
yeah, can happen in the mouth. Yeah, mouth, very common in the mouth.
Oh.
And it can turn to dysplastic. I mean, it can turn to malignancy. Yeah, so we have to regularly monitor it. Okay, ulcers is very common, but not all ulcers are the same. On the far left-hand side, this is the normal aptus ulcer where you can get on and off and things like that. On the middle one here, this is also an aptus ulcer, but this is called a major aptus ulcer, which is a little bit more deeper, more painful. But this also will resolve by itself, you know, you take proper hydration and things like that. But on the right, okay, this is suspicious already. This looks like more like a CA, especially ulcer that is non-healing, non-painful, and it has been there for more than 2 or 3 weeks. Then it has to be investigated. It has to, you know, biopsied and sent for histopathological examination. On the lower here, on the lower left, also ulcer, but the pattern of the ulcer looks different. These are called hepatic ulcers. Means it's part of the condition that affects the general body, but it's more pronounced in the palate. So patient has some herpetic lesions that cause this type of ulcer. On the lower right, this patient was actually in denial. We heard an ulcer, but he said, I just accidentally bit my mouth and it came like this. I'm sure it's nothing. Please give me medicine and it'll be cured. But once we did the biopsy and it came out with SCC. So SCC of the tongue needs multidisciplinary, as the lips here need multidisciplinary approach where we need to have a wide excision and a removal of the submandibular gland and also reconstruction of the lower lip. So we need to have an oncologist on board. We need to have an ENT on board, even plastic surgeon on board. So it is an extensive time of treatment. Okay, this patient had poor denture hygiene. No, he's edentulous, I think one teeth only, but no, they don't remove the teeth at night. They don't clean it properly. And what happens is all this type of infection happens in the mouth. These are a fungal infection. Typically, it will clear if you just take away the denture and give the patient antifungal mouthwash. That's what we did. And then we educated him properly on taking care of his oral hygiene, because this one can get worse, can erode the mucosa, cause problem. Okay, like this, a white coating in the tongue also is not normal. Okay, this patient came in with such things which he shared some intimate details of what they have done. So we had to do the proper medical examination so that we are sure he does not have any infectious STD or other disease. But luckily, this was also just a fungal disease. He was given a course of oral antifungal treatment, and this cleared out. Many young people, they don't realize a lot of things can go wrong if they are not protected. So he needs some education on the other part. So send him to the counselors also. Okay, another area that commonly comes to us maxillofacial surgeons is the pain in the TMJ. TMJ are temporomandibular joint. All the joint in the body goes to the orthopedic surgeon except this joint. Okay? Because this joint is very unique. It is connected, two joint connected with a bone and with a teeth attached. A lot of patients will have some clicking, some noise when they open their mouth, sometimes even limited mouth opening or pain around the joint there. So there are some various treatments, modalities that we can offer. Some even can benefit from acupuncture or physiotherapy, but it depends on, it can be just muscular pain. It can be because dearrangement in the joint itself. That means the proper disc and the joint is not in the proper position. So we need to reposition it in the proper position if it's not in the proper position. Or sometimes it is just some pathology in the condyle or the bone. some osteochondritis or things like that. So we have to investigate and find out what is the problem. Like this case, it was just a dislocation. If you see the position of the condyle, it is not in the glenoid fossa. So the patient comes with a deviated mandible at one side. So we just have to manipulate and reposition it, and then the patient can be back to the normal condition. But in order to manipulate and reposition, you need to have the training and the knowledge of sometimes the patient just don't know where to go. They go to one medical practitioner to another medical practitioner, and they just go around and all around. Yeah.
I used to get
So
this when
yeah.
pregnant. Is pregnancy risk factor
Precondition.
for this?
Not really. This one, because the joint itself becomes loose or lax. When they come lax like that, then they open too big, or they open their mouth for yawning, and then they dislocate it. So some people are, predisposed to this. Some people are not. You find pregnant patient having this problem?
No, myself. Every time
Oh,
I'm pregnant, I
gosh.
have TMJ joint
Already.
pain.
Okay. Yeah, TMJ joint pain is related to stress. So when you get pregnant, you are more stressed. So you can always go to stress and be safe. That is one of the cause. Okay, these are some of the treatment. You can, if the patient has bruxing tendency, that means they clench their teeth at night. We can give them something called a mouth guard. Sometimes we can, if there is known inflammation around the joint, we can give some injection. This is arthroscopy or arthrosynthesis, where we inject saline only sometimes, or sometimes you can inject some lubrication, some filler types of lubrication, even some steroids, like how the orthopedic surgeons will inject some steroids. So these are some of the splints that is used to manipulate or reposition the joint so that the disc in between the joint are captured and positioned properly. So if the condyle is fractured, also can happen. This is usually MVA. So it looks barbaric, but this is one of the treatment where the upper and lower teeth are tied together so that the condyle heals in the proper position. I'm told this is a good way to reduce weight also. So if anyone wants to reduce weight, you can tie upper and lower jaw together. Okay, yeah. So you can do right up to total joint replacement. This case, the joints were fused, after trauma, and the joints fused, so he can't open the mouth. Can you imagine going around the world without opening the mouth? You can't eat, you can't speak. How you eat?
Oh,
So
55% of Malaysians need it.
yeah, okay. So this one we did a total joint replacement, where this joint is 3D printed in our facility. It's locally made, 100% locally made. So we design and print this joint. That's where I work together with Dr. Firdaus, where he has a facility to 3D print titanium metal products. So we plate and we put it there. So yeah. So another area that is becoming more and more popular is excessive daytime sleepiness. People just fall asleep while driving on the traffic light. Have you seen or heard that? This is because of OSA, obstructive sleep apnea. They are not getting proper sleep at night for don't know what reason. Okay, so they wake up in between. So we have to do a proper sleep study to make sure they do have this obstructive sleep apnea. And we do the imaging, and we work together with the ENT surgeons. Usually they will prescribe their PAP, BiPAP, or that a product that they use to supply oxygen, some machine BiPAP, yeah. CPAP, sorry, it's called CPAP. There's a positive pressure oxygen that is given to the patient. But many patients are not tolerant to this CPAP machine because it forces air into the lung, but some of the air goes inside the stomach. So they end up being bloated and it's noisy. Imagine sleeping with someone who has a machine tied to the face. So there goes your romantic life or traveling with that. So they want something alternative. So this can be a simple alternative where this appliance is worn when they sleep, and it reposition the jaw so that the airway is opened up. Okay. Some even can't tolerate this sample impliers. Then we can offer something called a maxillomandibular advancement surgery, where the maxilla and mandible are postured forward. You see in this X-ray on the left, see this, the dark line is the airway. So this one, the airway is opened up. So when you reposition the maxilla and mandible forward, the airway opens up at the back. So the patient, this is a permanent solution for patients who have really, not for every patient, who have a serious problem in the obstructive sleep apnea. So I've come to the last part. So my conclusion would be total health involves having a healthy mouth and face. And oral and maxillofacial facility and skill is, I feel, is still underutilized in the, especially in the private hospitals. So I can take some questions.
Okay, I think there's a question in on Facebook. Shirley
Uh-huh.
Tan asked, what caused her to have this dislocated jaw, the
Okay.
early days?
Earlier, dislocated jaw can be many things. Some people are born with loose joints, means they are easy to dislocate. But some, accidentally they open too big, it gets dislocated. Or one of the common reason is trauma. You fall down, somebody punch your jaw, then it moved out of the glenoid fossa, then it gets dislocated. So there are many causes, but some causes are just, they just went for a to take the Big Mac, 2, 3 patties there. They opened as much as big as possible, and then it got stuck there.
God.
So no, if you go
Yeah,
for Big Mac, take a smaller bite. Don't
be
don't
like me.
open too big.
I always,
Yeah.
always when I eat burger, I need double patty.
You are take smaller bites.
Okay. I'm
Okay.
going to share. This is for ESET.
Okay.
Yeah. Any questions? And then there's one more. It's actually the CPD for doctors, which we submit to MMAs. So
Mhm.
sorry to this. Okay. So sorry.
Mhm. So I can stop sharing, so you can go to the questions.
Yeah, you can stop sharing.
Okay. Share. Stop sharing. Stop sharing. How do I stop sharing?
How do you press
I stopped on my end.
You can stop your hand. Okay, okay, good.
okay.
Oh,
These are for doctors.
okay.
Okay. So any questions? Any more questions?
Yeah, any more questions?
I think that was a very interesting talk.
Thank you. Thank you so much. Glad you enjoyed it.
Yeah, yeah. You know that teeth can grow else.
Yeah, it can grow. Ectopic pregnancy. It can be a topic.
Oh,
And
yes. That would be the term for it.
Yeah.
Oh, okay. Yeah, I don't mind going for more what you call it, dental webinars.
Yes, sure.
I was a bit
Yeah.
worried, but then
Yeah.
the attendance is good, the interest, the talk is very good, very well done. And then it's very interesting.
Okay, right.
Things that we thought that the plastic would do actually is
done
by you guys.
Right. We work together, yeah. Because the problem is a lot of hospitals don't have maxillofacial, so the plastic, sort of patient need the treatment, so somehow they have to do also, yeah.
Okay. Dr. Darrow commented, I find Mr. Kathir's presentation make it look so simple. I'm sure.
Yeah.
Yes. I enjoyed this webinar a lot, and thank you to you. Oh, thank you.
Thank you, Dr. Darrell. Yeah.
I also enjoyed it. I like it when it's visual, and then it's interesting, and then there is before and after. I really enjoy when there's before and after.
Right.
So, okay, any more? Okay, Shirley Tang, can people with teeth filling do braces?
Yes, definitely. Yeah. Now braces also, we have some new type of braces which we are called aligners. Aligners, it does not look like braces, but it can still move the teeth. So that can be another webinar by itself. How to move teeth. Yeah.
Can I ask you? When it was my time, I did braces too. Of course, with this Dato.
Dr. Dato Low, LOW. Yeah.
Yeah, that's right. Low or Lao? Lao.
LOW, yeah.
Lao.
Must be, yeah, he is orthodontist, yeah.
Yes. But you know, we do it when we were very young. But now I see a lot of people doing braces, even
Hmm.
at 40 plus.
Yeah. Actually, there is no age limit for braces. Those who are 40 plus, they didn't have the opportunity of the chance. Because last time braces were just for affluent or well-to-do kids. Right? Yeah. So a lot of people, the parents at that time had 4 or 5 children, and teeth was the least thing in their mind. They were more concerned on putting the food on the table. So now they're working, they want to look good, so they come for braces. That's why we have a lot of adult patients. And this adult patient, if they go to the KKM or the government sector, they won't take because there's an age limit. In the government sector, only they will treat up to 16 years old. So most of these
Oh,
adult
no
patients.
wonder I had to do it at 16.
Yeah.
I
Yeah.
never wore retainer. You see, now it's
Yeah. I'll cook it already.
yeah, a little bit. But
A little bit,
cannot be
yeah, but
good.
still not too bad. Yeah. So yeah, that's why we get a lot of adult patient, which is fine. Yeah, everybody wants to look good. Why not?
Oh,
Uh,
interesting. But
uh,
okay, is it more stubborn, the movement of the teeth?
yeah,
Does it take longer?
we have our challenges with adult patient. Definitely, the bone is more, less flexible, less amenable to movement, but it can still move. It takes a little bit longer, but we have developed better techniques, better materials, better methods to make it less comfortable. I mean, less uncomfortable. So a lot of adult patients are tolerant and they are willing to undergo this type of treatment. So it can be done a bit longer, yes, but things have improved since your time.
Okay. Yeah, my time was a long time ago. Okay, Michelle Anis asked, okay, is it normal when sometimes when you yawn, then suddenly the mouth cramps?
Yeah, you're nearing to, it's not normal. You shouldn't cramp. Means when you're yawning, you have to be careful not to open too big. You have to actually support your jaw so that don't open too big. So it can, cause dislocation and you won't be able to close your mouth. Then you'll have to come to an emergency and then
It
get
has
that
happened
fixed.
before.
It has happened before. That's why he has to be careful. These are the patients who are, predisposed to having the TMJ dislocation. So he has to be careful when he yawns. Support the mandible.
Oh, even from yawning.
Yeah, even from yawning, yeah. Because they don't control it. It's uncontrollable. So it can dislocate, yeah.
Okay, I think we will end here. Thank you very much. Maybe
Thank you, yeah.
we'll do more session with you. Maybe I'll sit down and we can formulate something.
Yeah, sure.
Yeah. Okay, nice meeting you.
Thank you. Nice meeting you.
Bye.
Take care. All the best.
Okay,
Thanks. Bye.
bye, guys.
Bye. Bye.
See you next week. Next week we have, I'm not sure what's the title. Then after that, I go on leave for a week. Bye. Bye, guys.
Bye. Thank you, Dr. Betty. Dr. Kathir left already.
Yeah, thank you.
Bye.